Dr. Crystal Hall is an associate professor at University of Washington's Evans School of Public Policy and Governance. She is an expert in applied behavioral science and just finished serving as a fellow on the White House Social and Behavioral Sciences team, although I hear that they keep dragging her back to DC. She also had the pleasure of doing her doctoral work with the star of last year's conference, Dr. Eldar Shafir. So folks, sit up straight in your chairs. Good posture, please. Put on your seatbelts and get ready. Ladies and gentlemen, Crystal Hall.
Today, what I'm going to bring to you is a slightly different perspective. So my background and training is in the area of social psychology. And I'm a social psychologist that ended up in a school of public policy, which is becoming a little less odd, but still a little odd. And the work that I do takes insights from psychology with the hopes of improving the way that we design and implement public policy. And I'll talk a lot about what I think that means. I think it's a really important perspective because folks coming from my field and my training have a lot of insights about decision-making and behavior that are often surprisingly not necessarily considered when we're designing and implementing policy. And Stephanie said something that I want to highlight because I think that both of our talks this morning really underscored this idea that the problem is not in the individual. And I think that we probably didn't need to convince all of you of that, but I hope that all the evidence that you've seen today really helps us drill that home a little bit more. And what I'm hoping to do in this talk, and then even more in the workshops this afternoon, is really talk a little bit more about how do we take some of these insights and how can we turn them into potential tools and potential novel ways of thinking of addressing some of the problems that we see. And a good place to start thinking about that is just thinking about the many ways that the assumptions that we have about people's behavior are faulty. Because I think very often when we're trying to address some of the big issues that we see, we often think we understand the problem and think it's about finding the solution. And what I'd like to argue is that very often our assumptions are just incorrect. And I think we've seen bits of that already with the talks this morning. And so I'll give you a little bit more evidence of that. And we often think about if we can just design the right program, then the outcomes will follow. And there's that big thing in the middle called the implementation that's very, very important. And I think the fields of social psychology, cognitive psychology have a lot to offer. And so what I'll do is I'll talk a little bit about this from the perspective of some of my own work. And then I'd like to talk a little bit about the work that I did in Washington, D.C. for the last year that's still ongoing, to give you some examples across a few different domains to help you think about how we might try to incorporate some of these insights into the work that we do from a really practical perspective. And again, just keeping in mind this idea that the assumptions that we have are often very, very faulty and can cause us to be really inefficient, and ineffective in the way that we implement the programs that we've designed. And so I'll just start and talk really briefly about a way we might think about decision-making in the context of poverty. And so I'm a psychologist. A lot of the work that I do falls into an area that we call judgment and decision-making, and it's really about understanding, how do people process information? How do they make judgments? And we can think about this when we look at decision-making in the context of poverty as a specialized context, right? People that are living under huge constraints. And those of you that were here last year and heard Eldar speak heard a lot about this idea of scarcity and the way that scarcity in general has an impact on our decision-making. And so when we think about decision-making in the context of poverty, there are a couple different perspectives that have been taken. We can think about people as being rational agents. This is a more traditional economic view. This is something that we know doesn't predict behavior of anyone very effectively, much less people living in the context of poverty. And so just assuming that we can have a model of behavior that assumes we're all really well-calculating machines and that that's good enough doesn't really work from a practical perspective. A second perspective that's been taken is this idea of a culture of poverty view, which is almost, I would say in a way, pathologizes the behavior of the poor and causes us to think about low-income individuals as being faulty and problematic and not being able to make the right decisions. And again, there's no evidence for this either. And so another way to think about it, a way that a psychologist might think about this, we can call it a behavioral perspective, is let's actually look at the context of poverty. Let's actually look at the situation and try to understand the constraints that are placed on people and how they might have an impact on behavior. And so there's great work that talks about this and gives evidence of how it's often a better predictor of behavior. And then you can take it to another step and think about how there are many policy implications that can derive from that. And so I'll give you a couple examples from my own work, starting with, and Kathy, thank you for setting me up, talking about my work on self-affirmation and the stigma of poverty. And so this was some work that we conducted. We were inspired by work that had been done looking at self-affirmation as a tool for helping students cope with the stigma of race. And in particular, comparing black students to white students, looking at academic achievement, and finding that you could decrease the race achievement gap by giving black students an opportunity to affirm themselves. So this is a context where there is potentially a very high likelihood of a stereotype about your performance as a black student. And if you're given an opportunity to affirm some of your own values, you actually see that gap decrease. The same thing has actually been shown for gender. So you can look at women in math and science, and you see a similar pattern. And so we wanted to try this looking at poverty. And so we went to a soup kitchen, and we were talking to, the staff of the soup kitchen told us that they knew that many of the folks there weren't necessarily filing their taxes, weren't going to get help filing their taxes for free, and they were really interested in spreading the word about this. And so we designed an intervention where we had folks come sit in a room, and we asked them to either tell us about a situation where they had experienced some type of personal success. And they sat in a room on their own. We gave them a little tape recorder, and they told this story about a personal success. In our comparison condition, we had them talk about what they eat on a typical day. And then, like many social psychology experiments, when you think the experiment's over, it's not actually over. We're still watching. So people leave, and then they're given an opportunity by another individual who is another experimenter, and they're given information about the earned income tax credit. So we had this little flyer that we were handing out. And we measured whether folks would stop and have this conversation with folks about this and whether they took the information. And this is a situation that could have been potentially threatening. You're a low-income individual, you're in a soup kitchen, you're being asked to talk about your finances. But what we found was that the folks that had been affirmed were twice as likely to take this information. And we weren't able to track what they did with it, but it was pretty astonishing to us that we just got them to stop for a minute, listen to us, take this information when we had them engage into this activity that we interpreted as decreasing some of the psychological stress that they might have been under. We did some other experiments. I won't go through any more of them other than this one, where we basically showed that the individuals that had been affirmed performed better at some of these little silly cognitive tasks. And so we interpreted that as meaning when we affirmed them, they actually had a little bit more juice. They were able to engage a little bit more directly and for longer. I think it's worth noting, you don't see this pattern when you affirm high-income folks. So when we had high-income individuals do the same tasks, we don't actually see this. And we interpret that as meaning they're not under the same type of threat, right? A higher-income individual in Princeton, New Jersey isn't really threatened when a graduate student asks them to do these little cognitive tasks in the way that a low-income individual in Trenton, New Jersey, in a soup kitchen might be. And this is, the idea of self-affirmation is something that has been shown in other domains as well. It's been shown as that people receiving potentially threatening health information actually are more likely to take it when they've been affirmed as well. So really, you can think about this generally with the idea of psychological threat, but when we consider it for low-income populations, these are folks who very often when we engage with them, it's in an environment that might feel inherently threatening. You're talking to someone who may have a power dynamic over you and you may feel is judging you. And so if we can find ways to alleviate some of that stress, some of that discomfort, you may see people are more, it's easier for them to engage, and then you may see better outcomes. I'll give another example. This is some work that I did with my colleague in the School of Social Work, Jenny Romick, looking at tax time decision-making. And we were really interested in tax time because for low-income families, tax time is a huge financial event. If you file your taxes, if you get the EITC, for that part of the low-income population, it's a place where you can potentially reset. You get a big windfall, you might be able to resolve some financial issues that you've had. And so we were really interested in how do people understand this process, and how does it have an impact on their behavior before and after. And we wrote 2 papers about this. One of them was qualitative, talking about people's understanding of the tax system, and I won't talk about that one. But the second paper we wrote was from a really surprising finding. This was not something that we were looking for. We had folks talk about their understanding of the tax system, but one of the other things we had them do, we went to a free tax preparation site, and we had them predict what their refund would be. And then we checked to see what it was after. And we thought that this might have an impact on some of our other qualitative work. We didn't expect to see the pattern that we found, which was that about 75% of folks actually underestimated their refund. And we saw this over a couple different years, and we looked for something in the tax code that might explain it, and we actually couldn't find it. We found that people tended to underestimate. And this was really interesting to us because we thought, and this is something we'd like to explore in the future, is this might be a lever that we could use if we want to design an intervention, potentially around saving. So if people are getting back more money than they expect, maybe we can prime them a little earlier to think about what they might do with that extra money. And so it's something that was very surprising, and we didn't anticipate, but just by asking the question, we found out that there was this pattern of behavior. And I think this type of work really gives us a lot of opportunities to really think about what can we do beyond simply providing people with more information and trying to educate them, because we spend a lot of effort doing that, but they're not necessarily the only tools, right? Sometimes we have to think about how can we go beyond this approach to find solutions that are a little bit more innovative. And so generally, this is something that I've been thinking about more, especially in the last several years, is how is psychology a tool for policy interventions? And I think there's a lot of ways that we can look at this, and there's a lot of potential ways that we can use psychology as a tool. It can help us understand some of these behavioral puzzles that we see. So why are there often low take-up rates of programs and services? Why do we sometimes see low take-up rates of formal banking and savings tools? And this approach can help us really think about what's the real context? How can we actually understand the context? How can we improve the way that we design and implement these policies, and often reduce a lot of the costs that are associated with them? And a big piece of that is that we often are making very faulty assumptions about what people want and need. And stepping back and trying to look at the context can help us avoid that. So this problem that we see often is that program design can be really misguided in some cases. And more importantly, sometimes the implementation can be misguided. And so then you may see poor perceptions by clients, which can lead to negative outcomes. I've done some work looking at the Housing Choice Voucher program. And here there's this big assumption that we provide people with subsidies to help them get access to better neighborhoods, right? Exactly. Some of you are laughing. And there's a lot of assumptions here, right? That people want to move into what they think are better neighborhoods and schools, that they understand, or they have the same perceptions of what is a better neighborhood or a better school, that they're dissatisfied with their existing networks and communities. And so I've done some work with some housing scholars where we tracked people that had housing subsidies that were trying to decide where to move. And we tried to look at when people are actually going through the process of trying to move, what constraints do they face? And what we actually found was that real-time resource constraints actually had a huge impact. So the cost of searching, the cost of moving was often an immediate concern that people had to think about, right? So they didn't necessarily have the space to consider a lot of the other things that we might think as outsiders are the important things to think about. And so this is something that we're exploring a little bit more. And there's other work recently that supports this idea. And it means that maybe we should think about how we frame some of these programs and what type of support do people need. Because it may be that giving somebody a housing subsidy and giving them, potentially 60 days to move isn't really enough to help them fully take advantage of that benefit. And so a very costly program may be less effective because of this. And again, generally, this brings us back to this idea of resource scarcity. Time is often very much like money. When we don't have a lot of time, we often make the same types of trade-offs, we make the same types of decision patterns as people that don't have a lot of money. And this is the work that Eldar Shafir and Sendhil Mullainathan's work shows us. And so if we start to think about that general psychology of how do people behave when they have a scarce resource, we can think more creatively about how can we help them overcome that deficit. And I'm sure for many of you, you deal with time as being very scarce, right? And you make a lot of trade-offs, and you make a lot of short-term myopic decisions. And the same types of trade-offs and decisions that very often low-income families are critiqued for making when they're trying to decide how to deal with their scarce resource of money. And so these assumptions really, really matter when we're trying to consider how do we more effectively design policies and programs to serve people more effectively. So in the last couple years, I've been thinking about these questions a little bit more, and I had the opportunity to spend the last year working with the social and behavioral sciences team. And I'll talk about the work here for the second part of my talk to give you some examples of how we're thinking about using behavioral science as a tool to serve the federal government and federal programs. So to give you a little bit of history, one of the earliest kind of real example we can find of a good use of behavioral science in the federal government came back in the early 2000s. So in 2001, it was shown that switching enrollment to opt-out versus opt-in for retirement savings drastically increased participation rates, right? Those of you that are familiar with the book Nudge know this. And hopefully now this is getting popular enough that it's not entirely surprising, right? That program design matters. The way that we construct decision environments really, really matter. And so in 2006, the Pension Protection Act, which actually codified this practice of automatically enrolling workers into retirement savings plans. Better outcomes for families when that happens automatically. And we can think about the many reasons why people may not do this, but it turns out this simple nudge has a big impact. And there's really good evidence that this has resulted in billions of dollars of savings for American workers. And so the SBST was built over the last couple years. There was a seed planted, her name is Maya, in the Office of Science and Technology Policy in 2013. And Maya came into OSTP, which is a part of the White House, to help the Office of Science and Technology Policy think about how behavioral science could be used across the federal government. And so there were a couple convenings held, and then resources were finally allocated by the General Services Administration to build a team. And so in the Office of Government-Wide Policy, which is distinct from the White House, is where the team kind of functionally sits. And for about a year and a half, the team quickly tried to build some evidence for why this was something that would be worthwhile for the federal government. So conducting a couple dozen studies across the government showing places where these behavioral tweaks could have some real measurable impact on outcomes. And in 2015, September 15th, over at the end of the timeline here, the first report was released. And this is when the president also signed an executive order making the team permanent and instructing federal agencies to consider how to use these insights in the design and the implementation of their programs. And just about a month ago, we just celebrated the first anniversary of the team and released our second annual report. So what is the social and behavioral sciences team? We are a group of experts in applied behavioral science. I used to talk more about like behavioral science generally, but then it gets abbreviated to BS, which we don't like, and so we always like to say applied behavioral science. And the folks on the team come from a variety of backgrounds: psychology, economics, political science, design. Actually, design and human-computer interaction is a big part of our team. Those folks work really, really well with the psychologists. I'll talk a little bit more about that. And the team is chaired by the Office of Science and Technology Policy under the White House. And then we have representation from a bunch of different agencies across the government, as well as a couple different offices under the Executive Office of the President. So we work a lot with the Domestic Policy Council, for example. And we take empirical findings from the social and behavioral sciences to try to find improvements to policies and programs for the benefit of the American people. And we do that by looking at the implementation of existing programs. So we are not meant to be a team that comes in and tells the Department of Justice, you should be doing this instead of this. We actually say, what are you doing? Is it working? Let's look at it. Let's think about how we might do it a little bit differently. And we have had to kind of sell ourselves as consultants. So we're kind of free within government consultants that go around and help the agencies implement some of these changes. And then in exchange, we try to measure the impacts. This gives you an idea of some of the departments and agencies that have worked with us and that are now represented on the subcommittee. It's growing, actually, I think, by the week and the month. And then I mentioned, again, these White House offices down at the bottom are also represented by the team, or represented on the bigger collective team. So we work across a lot of different agencies on a lot of different types of outcomes, and I'll give you a few examples of those in a couple moments. One of the most interesting things about the team, I think, is that we really do try to look at a wide variety of outcomes. And this is a kind of a rough description of the domains that we work in. One of the most exciting things for me about working on this team is that we work very, very collaboratively. So it's a relatively small team. During my time there, we had about a dozen folks that were full-time, and that's a mixture of folks that were coming from academic institutions on rotations, a few full-time folks, and some folks that are on loan from other government agencies. And we work across a variety of domains, and we all kind of use our strengths when they're needed in different areas. And so during my year with the team, just to give you a quick example of a piece of the types of things I worked on, I traveled to South Africa to work with USAID. We have a portfolio of projects in about 5 or 6 different countries, and so I went to do a training with some of our partners in South Africa. I have also worked with mental health among active duty military folks for the Department of Defense, and also done some criminal justice work for the Department of Justice. And that's just kind of a couple examples. And more generally, have been helping the team think about how to expand on some of these areas. And so right now, we're really trying to focus on our economic opportunity piece of the portfolio and access to benefits, and then also thinking about health outcomes, because we think they tie to a lot of the other things that we see up there. Interestingly, and I'll give one example of this, we've done a fair amount of work looking at just kind of internal government operations, because we actually found that we were, through a couple of our studies, literally able to help the government save like millions of dollars just by changing the way that some things were working internally. So we really have been able to build this team, making the case for why it is worth a sustained effort by the government. And our process is very particular. We like to think about, for any individual policy, what are the real goals, right? What is this policy trying to achieve, and how is it being measured? And then on the other side, how do people interact with the program? And this is the piece that I think we often forget about, right? We design a program, but we don't often think about how do people really interact with it, because there's this idea that, you know, if you build it, they will come. If people need a loan or they need health insurance, they will come get it. And so our team likes to come to agencies and say, well, let's hold off on that for a second, and let's actually look at how do people actually interact with the program. And so then in the middle, we look at how does the behavior play into that? So how do we take those touch points and connect it to the ultimate policy goals? And so there's a very often long and difficult process that we go through, and I'll talk about this afternoon, where we try to map out to understand how are people engaging, how do they understand the program, and where are there potential gaps between what we assume they're doing and what they're actually doing that we could potentially improve. And then we can perhaps design an intervention and test it once we've understood that. And so you can go to sbst.gov if you'd like to check it out, and check out our report, and it'll give you an idea of some of the work that we do. And I'll just give you a couple examples now. One study that we did last year was looking at enrollment in the thrift savings plans. This is a savings plan for service members that is quite underutilized. And it turned out that it seemed like this was a program where the Department of Defense was really puzzled that folks were not participating in this, and they were very frustrated that many people were leaving without having accumulated any long-term savings. And this was a really, really big priority for the agency. I should mention that almost every study that we do is really looking at some program or outcome that's a big priority for the agency. And what we found was that the way that folks had to sign up for this program was kind of buried in a lot of other information that we got. And so we said, if this is a priority, let's actually make it a little bit more salient and easy for people to sign up for. And so all we did was we came and simplified the form a little bit, gave folks a place where they could literally take about 5 minutes, sit down, and fill out this form, and then we were able to increase the number of folks that were actually signing up. And we're actually doing some more replications of this, and we've been able to find some even bigger participation rates. And what I should note is that this is a good place to remind you that what we're doing, we're not saying we can come in and fix all these programs. We're saying there may be little things that you're doing that are making them less effective. And because we work with often really, really big sample sizes, these small changes are resulting in hundreds of thousands, sometimes millions of dollars that are being saved, right? And I'll give a couple more examples of that. One of our favorite studies, this is one of the internal government relations studies, was looking at this very boring form. You don't really need to look at it very much. This was within the General Services Administration, and this was a fee that needed to be remitted by different types of contracts. And what they found was that very often it seemed like the government was not recouping all of the costs that they should have been. They weren't getting these fees paid. And we looked at some of the literature that has shown that when people actually sign a form at the beginning, so very often when you fill out a form, you fill out the form, then at the end you sign it saying this is all accurate. And it turns out, if you have people sign first, then fill out the form, they're actually more honest. And so what we found was that when we moved the signature box, when we made an upfront signature box on this form, 6% higher total payments, which was over $1 million. And this was over the course of, I think, 2 or 3 months. This is like our favorite, like telling the federal government, like, keep us around, because this is like more than we cost. So really, really simple tweak that gets us a better outcome. Another area that we were interested in was take-up of small microloans for farmers. There are some working in the federal government, I've learned about a lot of obscure programs. I don't know if any of you know about this. There's a microloan program that's run by USDA where small farmers can apply for up to $50,000. And usually they use this on upgrading equipment. The take-up rate is not great. And so they were very interested in this, and so we redesigned the letter. This is a very friendly version of a different type of communication that they sent out. And there's a lot I won't walk through all the components of this. This is the kind of thing I'll talk about in the workshop. But we revised this letter and found that we got many more people applying for these loans. there's a replication that's actually in the field now where we're specifically targeting female farmers. So we had a similar intervention, but really tried to leverage peer effects. And so we have a photo of a female farmer, and we give them more information about female farmers to see if that increases their take-up of this program. And this increased the percent by 63% of people that obtained a microloan over the course of, I think, 3 or 6 months. Another area that has been a big part of our portfolio, and this data that I'll talk about is a little preliminary, we've got a lot of other work underway in this area, is around student loan debt. And one example that I'll give you is specifically about people who are in default, who the government is trying to reach to get them to sign up for a rehabilitation program. And so here, and the sample size here was about 66,000 borrowers. We were trying out different types of communication. So we were looking at, can we increase calls to inquire about loan rehabilitation? And so in one study, we actually found that a negative email, so this is an email that actually highlighted potentially why it was bad to have your loan in default without taking care of it, versus the positive aspects of what would happen that would be good if you fixed it. We found the negative email was a little bit more effective at getting people to call. But then in another study, what was even more effective than that was actually giving people an email telling them that they were in default, asking them to call to rehabilitate, but suggesting a time that they call. And this is pretty arbitrary. I think it said, try to call on this date at 2 p.m. And people didn't need to call at that time. There's a lot of hours, but just suggesting a time actually increased it even a little bit more than the negative email. And so we have a lot of studies underway now where we're looking at how we can leverage some of these types of insights a little more, because this is a very, very hard to reach population, as I'm sure you can imagine. One more set of examples. We've just started some work in the area of criminal justice reform. And this is actually an area where we have not yet done any experimental work, but we've done some work helping to improve communication. And so I'll give you 2 quick examples. The first one was a re-entry handbook that's issued by the government to help folks as they're coming out and taking the next steps they need to take to move on with their life. And we were given this handbook, and it was kind of just messy and confusing and dense, and we said, well, let's think about how we can use what we know about behavioral science to improve this. And so we created a much friendlier looking handbook that included some checklists of things to do before release, upon release, and by a certain time after you've been released. And so far, we've gotten really great feedback that folks are really appreciative of this, and it seems like they're using it more, and so it's something that we're looking into evaluating in the future. Another project that I've worked on has been working with the Task Force on 21st Century Policing, which has, those of you that are familiar, the report was released in the spring of 2015, and gives a lot of great suggestions to primarily law enforcement on how we can improve practices. And the White House and the Department of Justice are really interested in trying to communicate this to average citizens a little better. And so I worked with one of our designers on the team to create what we called a community action deck. And I'm not going to give any other examples of this now in the interest of time, but what we did here is we took the report, we looked at the structure of the report, and we thought about what are really simple, concrete actions that individuals can take that want to engage in this space, in the idea that it can create longer and potentially larger engagements. And so we worked with DOJ and the White House to develop this, and we're starting to test it in a few cities around the country, and hopefully, ultimately, it will be released with the other materials, including the big report and implementation guide from the Task Force on Policing. And again, using a lot of the principles we know from behavioral science to think about how do we communicate this more effectively to Americans that are interested in this topic. And so in general, I think I want to highlight that I think what has made a lot of this work so successful is that we really work with the agencies and help them think about, in a different way, how do you look at your program, and what are you assuming about what people need or want? And how can we avoid that? How can we really understand the context and design these programs and implement these programs so they're more effective for the people that they serve? And it's in some ways very simple and in some ways very difficult. But I think there's a lot of potential, and there's a lot of big questions that we hope to keep trying to tackle. And I think that's all the time we have. So thanks.